So more work on obtaining vagal tone. So vagal tone is a great way to help oneself and obtain wellness. Again, it's not one trick helps everybody. It's part of a soup, or as I say, a gumbo, because it's sort of the sticky mess that helps move in a direction. So often you need things in the day that might help you because it's really just not one thing fix it all. That's probably the trap that's out there that one thing can do it all because the autonomic nervous system's everywhere. So hard to believe that one thing can do it all when there's so many circuits and pathways and nerve levels that are doing things. But there's things that you can do that help much. And one of the most accessible ways to the vagal system are the eyes because the eyes sort of lead the body. It's our most dominant sense, and our eyes have a way to help vagal tone. Basically, that's much about our tracking and our glare and our eye focus can set vagal tone. Some is based upon a diving reflex that when we hit the water, um, our heart rates will slow down instantly to save energy called a mammalian diving reflex. But there's things that you can do. So important aspect is many of you are dysregulated when you do these responses because of a few reasons. You feel very symptomatic, all the internal dialogue of your body. You might feel sick when you do these maneuvers initially, so don't give up and keep working with it. It's going to take a lot of trial and error and failure and trial to get it right. So keep trying. Two, if you're prone to significant bradycardia or slow heart rate, um, just be patient. And then three, it might seem odd. So yes, a lot of it's odd. Your bodies feel odd. So a lot of this seems odd. And then also, if you have any ocular eye issues, just make sure there's no reason why from your eye physician, eye provider that you cannot do this. So one is you really want to prepare for this. One's called gentle ocular pressure. You don't have to push hard. So when you push in your eyes, it actually will create vagal optimization. Your eyes have connections that will connect to your vagal. Some more high dramatic pressure on the eyes will actually lower your heart rate. That's why be careful with people who are prone to bradycardia and really low heart rates. But gentle pressure on the eyes for maybe 10, 20, 30 seconds. So what you can do is if you're in a high sympathetic state or through the day, if you're okay, is to really work on optimizing vagal tone is to just use the palms of your hands and just gentle pressure in the eyes. If you have contacts in your eyes, you can still do it, but just gentle pressure, breathing in through your nose, out through your mouth, in through your nose, out through your mouth, gentle pressure. You can let in and out on the pressure. You might feel a little swirly fireworks in your eyes. That's normal. We let go. Things might seem a little bright and shiny in your eyes. That's okay. And the pressure can be as much as you want to tolerate. And as you do that, let back and forth. That actually optimizes vagal tone. Sometimes people might feel a little queasy when they first do it or do it for a while. And what would be neat when you do that is to have an intent like, I am okay, I am good, I am a worthy person, some affirmations. It helps when you're sick, your brain's telling your body you're not good. So it's important to actually, when you do this, is to say you're okay. So if I go this way, you can see where my hands are and really have that intent. So that's called the ocular cardiac reflex. All that wiring will go to the vagal system and say, whoa, let's get vagal, let's sympathetic. It can help. The more you do it, the more you lean in that direction to vagal. I'm not telling you to be all day that way. The other one is eye movement. So for all of you in that sympathetic state, you're getting all this input all day long that your body's off, it optimizes and maximizes this vestibular proprioception balance that you're off, creates that ongoing sense that you're rocking and feeling that you need to, your body's trying to feel your balance out. That's why many of you feel very dizzy and vertigo. And why you go for testing, MRIs and vestibular testing, it looks fine. But it's that proprioception activation that your body's signaling that something's off all day long, that you're just feeling this sore sense of rocking on a boat, on sponges, motion, rocking, on a merry-go-round sense, whatever we want to use. So that's why ocular tracking helps gentle, because eye movements increases blood flow to the vertebral artery in the back part of the brain, vertebral artery, which will increase vagal tone. So gentle eye movements. So very gentle, and it creates that soft glare as opposed to that sympathetic, which creates that eye tracking movements, and that very activated state, which is a hard glare. Hard glare is when you move your eyes like this. I'm dramatizing it currently. So you can pick something very pleasant to look at, like um, a color. I tend to want to use maybe a nice color object that I like. I love blue. So what I'll do is just gentle movements, maybe about 10 inches away from you, and just focus small movements. And again, many of you are, it's like a box, slow movements. Many of you are queasy and nauseous, so you might feel that way and don't like how this feels initially. Do this a few times a day, and you don't have to do it with the ocular pressure, eye pressure movement maneuver. When you're doing this, you might really want to do some affirmations that my body is safe, I am safe, I am not where my body is before, and some good intention work. Affirmation intention work is putting some things into the present where you are not now. So all that stuff, have something good that you're working on. And it could be really small if you want to be. If you want to be, just up, down, or just side to side. Small movements. It's really important when you're doing that, you have no thoughts, but really you want to actually have something in your head. Like really, I think really the most important thing is saying, I am here now. I am doing this. I'm really helping myself. And it helps, eye movements, eye pressure helps vagal tone because that's where eye movements are really tied into. So these are little helps because we do believe in you. Even the fact you're watching this shows that you're doing something to help yourself. So thank you for watching, and we believe in you. Have mercy for yourself.